countries at all levels of economic development are concerned about the impact of the financial crisis on health. In a time of austerity, how do we set priorities? How do we decide what to maintain, to continue, and what to cut?
In one United Kingdom Sunday newspaper yesterday, it was reported that financial experts around the world were giving up their usual sources of economic evidence and instead turning to astrology for help in navigating the global financial crisis. Desperate times do indeed call for desperate measures, but today WHO is inviting you, all of you, to provide the best expertise and advice you can.
It is vital that we ensure resources for health do not fall. For rich countries, it is extremely important that we keep our promises. Promises made in Monterey, Gleneagles, Hokkaido, Doha, and in the halls of the European Union must now be kept. During the last 3 global recessions, official development assistance fell at precisely the time when it needed to rise.
It's terribly important to maintain the level of official development assistance going into this situation. But the crisis will also have a very big effect on the health systems in developing countries. On the one hand, costs of health are likely to increase. We found out, for example, that in the wake of the Argentine crisis 2001 to 2002, 38% of households cut back on expenditures for preventive care for children during this period. What policies can help in this process? Well, we think, first of all, financing services that are used directly by the poor are terribly important.
Civil society really kicks in when systems fail. They do not close down. The meeting houses, the cooperatives, the mosques, the churches, the temples, etc. do not close down. They remain there. But they do help societies cope, but there are limits.
It is therefore more important than ever to make sure that the public resources are utilized in a cost-efficient way so as to reduce the risk that those in most need will be those who shall have to pay the price.
In ILO, we are very much concerned by the impact of the crisis on decent work, which has many facets but includes in particularly all kinds of social security, particularly social protection in health, and access to health services for workers and their families.
I think the most hit in any financial crisis, as all of us know, are children and women.
We in developing countries have a particular problem. In crisis periods, we've always seen the same thing. Countries turn inwards. They start looking inwards rather than outwards.
We do try our best in our developing countries, but we all know that when there is a crisis, a budget crisis, one of the first casualties is health.
We need to act collectively on a large scale if we're to deal with these problems, and that means inter alia bringing in the principle of solidarity, and that in a very specific way in and between our countries.
It is important that the solidarity between the countries, between donor countries and WHO, other health programs and bilateral will remain. And of course the Netherlands will keep to that pact. And there is a second element of solidarity of a pact, and the pact between government and the citizens. And we have to really take care that we go on with our health expenditures and to fulfill that pact to the citizens. But there is a third element that I would like to introduce, and that is the solidarity between the citizens in a country, between the healthy people and the unhealthy people in a country, between the strong and the weak.
For about 3 hours we had very elaborate discussion on the topic, and I must say the member countries which participated in the discussion, they reiterated their commitment for health despite the crisis. There was not a single country who says that our health budget would be cut or that we cannot meet this particular challenge. But of course they had their own reservations. They said that they have to convince their governments, treasury and the health ministers.
Developing countries have not yet really felt the impact severely of the current downturn, but should be prepared to. Private investment to developing countries will probably fall from 1 trillion to $500 billion. Exports will fall. This year will be the first world decline in trade in almost 30 years. Direct foreign investment is likely to decline.